everyone. Hi, Dennis. Hey, Eric. Hi, Jake. Nice to see you on one of these. Hey, Jill. Hi, Robert. Hi, Shelly. Hey, Tommy. Glad we got you in. Hi, Brianne. Hope everyone's having a good day today.
Morning, everyone. Good morning, good morning. Happy Thursday. Hopefully y'all can see my screen. Yes, Jill, you get a gold star. You are sending to all panelists and attendees. Good job.
Gold star.
Autumn. How many people here call it autumn and how many people here call it fall? Oh, we have a debate. Brienne calls it autumn, Shelley calls it fall. Call it fall.
Why not?
Oh, should we do a poll? Autumn, do you call it autumn or do you call it fall?
I like Shelly's answer. I could go for some hot cocoa this afternoon. It sounds delicious. Even though it's actually pretty hot in Oakland today.
It was cold yesterday. Like, I don't know.
It was so cold yesterday.
Yeah,
it was like almost
was
raining when I went out in the morning.
Yeah.
I guess we shouldn't say that with some of our Southern California sons on the line. They won't have much empathy for us down in hot SoCal.
It is a little warm.
Robert, I hear you. I'm an East Coast native, and not having leaves that change color in the fall is a total culture shock being out here. Sorry, Brianne. We won't talk about how chilly it's been up in Oakland.
And 110, that is that's.
I wouldn't know what to do with myself. That is a wild.
I'd be at a pool party in Las Vegas or something like that. That's the only time I've experienced the temperature of 110 degrees. Oh gosh. We have a couple more minutes here and then we'll get started. Jay said 105 with Smoke and Bishop. Jay, make sure you send everything to all panelists and attendees so all your fellow sons can see. Hi, Angel. Nice to see you. Thank you for coming.
Hi. Thanks for having me. Hi.
Thanks so much for being here today. I'm so glad we were able to get you on. This is Elizabeth.
Yes, hi. I'm glad to be on. It's definitely been a hectic quarantine. For sure.
Yeah, that's what we're going to talk about. Christian, why don't we dive in since we have so much to do today, so much to tell people. Well, let's start right on time, and then as people jump on, they can, we'll just greet them using the chat.
Yeah. Hi, everyone. Welcome to August in this, I guess, interesting, challenging, and unique time. You are still free while I'm talking to type in your favorite season into the chat box. And please make sure you send it to all panelists and attendees. That way all your fellow sons can see. Otherwise, it's just going to be me, Elizabeth, Angela, Caroline, and Angel, and Viviana seeing it, and that's no fun. So today's pop-up training is going to be about wraparound COVID care. And I guess the reason we selected this topic is we got a lot of responses to the surveys, and again, thank you for taking the time to fill them out, regarding many different aspects of care relating to COVID, and also the kind of reality that COVID is not really going to be going away. we did a decent job as a state of kind of flattening the curve early, but the virus, as sick and tired of we are of the virus, London Breed has said this: the virus is not sick and tired of us. It actually is going to be here for a while until the reality is that we get a vaccine. So whether we like it or not, a lot of restrictive protocols are going to be in place. And so these are things we already know about our patients. Recovery is a journey. It takes time, independent of COVID or not. Part of recovery is not just medication. It's environment, it's counseling and therapy, behavioral and mental health, chronic pain treatment. It's all tied in together. And the reason I guess we as Sons are all here is, our patients are facing challenges starting or continuing their recovery, just even making it to their appointment. They face these challenges, again, independent of COVID, and we as Sons are here to help support them. And again, COVID's not helping this. We have to be prepared for the fact that this is going to be around. And again, if we're not preparing ourselves with tools, resources, troubleshooting problems, I guess we're not really doing as much as we can to help our patients, who are really the ones that are going to suffer the most because of this. So these are things that I think we all are aware of, but a lot of these bullet points that I'm going to hit are things that you all have told me, and things that I think we all should be aware of. So COVID's presenting challenges relating to housing and placement. So the first thing is the fact that your housing, sober living environments, detox facilities, they're just not accepting patients right now. They feel like they don't have the medical capacity or the staff to accept patients. COVID's led to increased substance use. So now there are more patients, now too many patients, and not enough spots. And, it may be a first come, first served basis. It may be, we're not accepting patients just because we just don't have the space. There are too many, rules and restrictions that are now put in place. And that leads me to the next point: limited capacity due to social and physical distancing guidelines. Homeless encampment now has to be distanced. Homeless shelter, beds got to be 6 feet apart now. They can't be 2 feet apart. So instead of having a capacity of 100, we now have a capacity of 60. That's 40 people now in your town, city, county that are now on the street. Something that's been very interesting is limited time in these facilities. So patients are having to be, quote unquote, discharged or released, or, a lot of them say they just kicked me out because of COVID. Instead of it being a 3-month stay, sorry, sir, ma'am, you got to leave. It's a 1-month stay now. And they've done nothing wrong, but that's just the COVID protocol. I hit on this point earlier, but I wanted to actually take it another step: is homelessness and increased substance use during COVID. And the next level is loss of income and evictions and, foreclosures. So these may be, your quote unquote housing stable substance use disorder patient who all they have is a substance use disorder, but they have a house and now they've lost their job. They can't afford rent. And the state and the federal government is not doing the greatest job in terms of extending rent moratoriums or helping out people who need that financial support so their house doesn't get foreclosed. And they're going to end up on the street, or they're going to end up in one of those shelters. And that's going to, kind of funnel and fuel into, the earlier points I hit. And the last thing, and this is again sort of related to the loss of job, loss of income, is loss or change of insurance status. And, I've said it multiple times. I hate insurance. I want to burn it to the ground. It's probably one of the least favorite things I do as a son. And I know all of you don't like to deal with insurance, but again, it's one of the core parts of our job, is helping our patients navigate the insurance system. And, when you lose your job and you just have a loss or sudden change of insurance, your access to care really, really suffers. So we brought on Angel Horvitz. She's a community health worker and works with the Whole Person Care Program. And I wanted her to come on to speak to her expertise in placing patients into housing and sober living environments and SNFs and residential treatment, and how what she was doing prior to COVID has really changed in terms of, now that there's COVID, what challenges she's facing. So Angel, if you'd like to unmute yourself and just talk about, prior to COVID, your workflow and how you would get patients into housing, and then the challenges you're facing now with COVID.
So prior to COVID, it was fairly simple, fairly quick to place people into shelters or temporary interim housing or even treatment centers, because the availability was there. We'd have, a 1 week period where they would transition from our referral, screening, admission, and then they would be in. And it was fairly simple, especially knowing the client and making sure we matched them to the right facility that met their needs. That seemed to be pretty smooth. Now, it's night and day. It really has been a struggle for me to accept that it's out of my hands. I have no control over getting these folks in now, whether it be because they have to have a COVID test and the agency's not testing, they want them to test somewhere else, or whether it be that they're full. I had one place tell me we're simply not going to risk the people who are already in our facility by accepting new people. So they just were not going to accept new people. It's been definitely challenging to overcome some of those, especially when there's nothing that you can do. And then there's agencies you don't even know what the protocol is. So how do you know how to connect?
Yeah, I think those are a lot of things that we've been hearing. I know within Alameda County, we had our detox facility shut down for a week because they had a positive COVID test in there.
Wow.
And it caused a bunch of our patients, I guess, I wouldn't say to quote unquote fall out of care, but to have relapses, and then we call it, have to restart or crash land in the ED again when they were doing, quite well. Does anyone else have any of is facing any of these issues right now where you were, I wouldn't say like Angel said, wouldn't be easy, but it would be a pretty straightforward track to placing patients prior to COVID, and now it's not straightforward at all. If anyone wants to type in the chat box or even offer a solution here. It doesn't have to be specific to you or your county, but thoughts or suggestions, because this is something that we need to prepare for.
So, and also, can I add? I had spoken with some of my colleagues before this meeting and asked them what are some of the things that have worked for them. And one of my colleagues had mentioned that they've been having everyone through our program that they get on their referral list test for COVID, just so that it's documented, so that any linkage after, that's already in the file, and it's already recently in the file, along with suggesting that they self-quarantine and suggest that they isolate so that they can let the facilities know that. That has been helpful, she said. So that's one way that might be helpful to some folks.
Great. Rebecca says that only private run facilities are even viable and reliable. The county residential system is slow and non-existent. I would agree with that. I would say that even my site's a county-based hospital. Even without COVID, they're kind of slow, and we have a good relationship with a lot of them. So in this time of COVID, definitely, it's even more slow. Eric said, I just keep contact with my referral base to know what specific policies they're enacting. I think that's a big thing. One of the skills that, we as sons and social workers and just, I consider us all clinicians and in a special way have to have is communication. And so if you're, communicating just within your site is important, but communicating with your community resources is huge. Let's see who else. Yeah, Camilla saying that we're experiencing reduced beds in the treatment facilities. Jill saying social distancing has been an issue. 1 out of 3 of the substance use residential locations that accept Medi-Cal patients are losing their contract. So they closed down on July 1st. That's not helping anyone. Mary Ann's saying that she's having great luck with the new partnership wellness and recovery benefit, getting people into inpatient programs. Mary Ann, do you want to speak to that? I don't know if someone can unmute her, if she can talk. Because I'm all for solutions.
Caroline, can we hear from Mary?
Hi, I think I'll try. Hi.
Hi, there you are. Nice to hear from
Hi,
you.
nice to see you all. Yeah, I actually am finding this, and probably because in this county we only had one, I'm in Mendocino County, we only had one option for inpatient programs. So we would resort to faith-based free programs to try to place people. So now that this benefit has been made available, I've gotten 5 or 6 patients into treatment since July 6th. And for me, anyway, it's been a really straightforward process, just knowing kind of the loopholes. And so what I've been doing is, if there aren't beds in our county program, then the patient is eligible to go to any facility in the 7 participating counties. So that's just one important piece. And you do have to advocate for that. But as long as I do that, then I've had luck getting patients placed. And almost immediately, it's almost, kind of a next day to just a few days to get them in, especially if they're going to be discharging or, needing placement.
Great. Yeah, I think that's kind of extending your reach now. as a son is something that I'm fully supportive of. Trying new facilities, working with the facilities you have now. I have a little meme on the right, that brace yourselves, winter is coming. If we as sons don't start preparing now, I think when winter comes, our homeless population, our underserved communities, our patients who are marginally housed, maybe they're living out of their car, or they're kind of couch surfing. They use those shelter resources, those extra programs much more in winter when the weather turns cold and it starts raining. And so having those, and it's already challenging for them to use those resources, and resources are always stretched in winter regardless of COVID. So preparing now, starting to gather that information now, maybe setting protocols and expectations, before winter comes, can really help you serve your patients. Because again, COVID's not going away, but then, just general flu season comes around, and like I said, weather turns, and, I've always found, at least just from my data and numbers for doing this for how many years, that there's an uptick in winter for just general substance use and in general people coming to the emergency department. So these are all things that I think we as sons should, one, be aware of, but two, be out in front of and be proactive with. Let's see if I have any other things here. Yeah, Jay said that some hotel rooms are being put aside for COVID positives in Mammoth. I think that's a big thing that we're going to, hit on in the second part of our training. Here today is SUD patients who are COVID positive versus COVID negative, and those residential areas and sober living environments kind of picking and choosing who they're going to take based on a COVID test. So I think we can go to our important reminders for everyone. We have our, updated Sun contact information via Slack. Again, if you have any new updated contact information, you can send it to myself, Elizabeth, Vanessa, Tommy, and we'll update it in our Sun contact info. Next, quote unquote, Sun pop-up training is not a Sun pop-up training. It's going to be a site recognition event on the 20th. So fortunate for all of you, you won't have to hear me talk so much. It's going to be a site recognition event. Please invite your hospital champions and really anyone else from your site who's really contributed to making your site a bridge site. We want you all there. It's going to be great. And again, thank you for your input on our surveys. We really appreciate it. And it's great feedback for us to help you guys. And I think I'm going to turn it over to Elizabeth for an update on BHPP.
Yeah, so hi everyone. I'm going to give you a quick update on what we know about the BHPP, and then also going to give a second plug for the site recognition event, which is 2 weeks from today in this time slot. So we have heard from the state that hospitals should be notified about receiving the BHPP pretty much any day now. We're anticipating that it will be in the first half of this month. So one thing you can do, we do understand that many of your jobs hinge on this money coming through. We're very, very sensitive to that. So one thing that might be helpful for you to do is to go to the person who submitted that application, who will be receiving the notification, and just say, hey, this is coming through. If your employment does hinge on that money coming through, talk to them about the timeline. We do anticipate that the funds will be awarded in the month of September. So anything you can do to advocate for your role so that you don't have to be either furloughed or temporarily laid off or have any kind of transition while that funding comes through, let us know if we can help you strategize that. But the money is coming. It's coming soon, and we're really excited to continue to operate as an organization that is going to support you every step of your son journey. So another thing you can do to get people at your hospitals excited for this money that's about to come down to either continue to fund you or maybe fund a second you or whatever you have in mind for the money is to invite them to this site recognition event on August 20th. So what we're going to do at that event is we're going to unveil the full program impact that we had in the last 18 months. We have a lot of amazing data and feedback that you've given us that we want to share, just so we can talk about how the program has been received by hospitals in California. And then the other thing we will do at that event is talk a little bit about what you can expect from us going forward. So we're really excited to do that. Please invite anybody from your hospital who might be involved in the next phase of implementation at your program. Really anybody. This is a great event for people in the C-suite. This is a great event for colleagues in a department where you may work collaboratively, such as social worker or case management. I think that everybody on this call, our Sun Network, know more than anybody the power of seeing how this model can impact patients, and we're really excited to unveil the impact that you all have had. So please attend. There will be a separate email. Yeah, Becky, I'll follow up with you. We did send an email invitation to all the site champions and sons. I know that some people have issues with the Google integration, so we'll share that registration link in the follow-up email, Christian. I'm looking at you for this training. And we'll also share it on the Slack channel probably at the end of this week or early next week so that people have a couple days to drum up interest. It's only an hour. Honestly, it's probably going to be a little shorter, even maybe about 45 minutes. So really a great opportunity to tune in and feel good about something. We know how hard you're all working, and we know the challenges that you're facing. That is the theme of this training. So really, we do expect that this site recognition event is going to give you an opportunity to feel really good and cheer for the work that you've done to keep it going. So any questions can come to me, Elizabeth, Slack or email, or I think you all know how to get me. And I can't wait to see you all there. Take it away, sons. We've got some good stuff coming up.
Yeah. Great. Thank you very much. Yeah, it's again, just like we did for the rally, bring people in general. It's I've seen the numbers. I'm not going to spill the beans, but it's pretty damn impressive to see what we've done. And then on top of it, we had a global pandemic that hit us at the end of this. So, the work that we've done for the people of California, just the think of it as the people of California, I think is just amazing. So, yeah, and you won't have to listen to me either. So there's double bonus. Data update. This is just a quick data update. We will still be collecting data. Melissa and Vanessa I think they've sent out some simplified data metrics. If they haven't, they will be sent out quite soon. And they're very simplified. It's not going to be anything extensive like we were all submitting before. I think if I'm remembering off the top of my head, there's 4 metrics. The first is going to be the total number of patients you've served as a son in the month. The second is going to be total number of opioid use disorder patients you've served. So, a lot of us as sons and sites have moved to, full substance use disorder, but they do still want to distinguish opioid use disorder patients. The third one is number of patients who received a dose of buprenorphine in the emergency department. And then the fourth one is going to be number of prescriptions written, I think from both inpatient and the emergency department. So 4 simple metrics. a lot more straightforward and easy. And I think you will still be submitting through the Sun portal on the California Bridge website. So we have 3 of our amazing sons here to present cases or challenges or just general situations that they've faced when it comes to COVID and, you know, just general wraparound care for our patients. So I will present them. First will be Rosemary, and what I'll say to all of the sons is we're going to go through all 3. We'll let all 3 of our sons talk, and then at the end of it, we'll take questions, comments, solutions, other people facing